Hello, everyone. I'm Dr. Diana Bitner of True Women's Health, and I'm very excited tonight to welcome Dr. Tracy Bennett. She is Chief Medical Officer of Ceek Women's Health. Thank you, Tracy, so much for being here. Tonight, we're going to talk about the instrument of change. Who would have thought we'd be talking about the speculum, first designed in the 1800s? And nothing against men gynecologists, but it was designed by a man. So finally, we have the inventor who won the TIME Magazine Invention of the Year for the speculum. So I'm really excited to get into this conversation. Everyone who's watching on YouTube or Facebook, we'd love your questions and your comments. Please don't be shy. And also, of course, afterwards, please share this. This is a topic that we don't always discuss. So I'd like to get right into it. Tracy, if you would, tell us your story. How did you get into this work in the first place?
Yeah. So first of all, Diana, thank you so much for having me. I've been looking forward to this conversation all week and really excited to tell our story. So I have been in the medical device, women's health medical device space for over 20 years now. So I have a lot of product development experience, but I also have a clinical background. I'm an MD, and so I have some clinical experience as well. And really what I'd like to do is, kind of work with products to make them better, to come up with solutions. And historically, most medical device companies look at how to make products better for the physicians using them, right? Correct. Which is, you have to have that. You absolutely have to have that. That's kind of the table stakes there. But what I like to do is really take a look at it from both ends of this, what I call both ends of the speculum, right? Speculum has been my focus for 20 years. And so how can we make it better, not only for the clinician, but how can we make it better for the patient?
But can we back up even more? Okay, so you go to medical school, you finish medical school, and you're like, I don't know that I want to do residency. I want to go into devices. Tell me, if you would, just about that.
Yeah, I was married during medical school. My husband had just graduated law school. We moved to upstate New York, where we currently live, and I started working, doing some consulting for a medical device firm up here, a medical device company up here. Sure. And I thought I would do it just temporarily. We had our first child. I thought I'll do this for a year, then I'll go back and finish my residency. And really what it turned into is a lifelong, what I call my accidental career, lifelong career. I'm very passionate about women's health. I always have. And I really took some knowledge that I gained in medical school and clinical practice, and then kind of combined that with, product development and what we can do to make products better for the clinicians. And then more recently, joining Ceek about 8 years ago, I had met Fati at ACOG, which is, as you know, a big OB/GYN conference about 10 years ago. Her and I shared a very big passion for what we can do to make this space better. And we thought we'd start with the basic instrument that's used over 90 million times a year just in the US alone. Like, think about that volume, right? And it's the starting point for an exam, a procedure. It's so crucial, but yet it hasn't been updated in almost 200 years.
Exactly. And when I first learned about you and Fati and your company Ceek we've got to give a big shout out to Rachel Bronshore. I mean, she connected us. She's a good friend and colleague, and she loves to connect people, and she just killed it on this one. So I'm so grateful to her. But when she first told me about this, I thought, the speculum, how can you really change that a whole lot, right? And the other question I asked her, and I know I asked you, was, isn't it more about who's using the speculum, right? How well the exam is done. But it's really way more than that. And I remember I asked you that question, and I'd love you to share your response, that women really care about this a lot more than maybe we think.
Absolutely. In fact, a lot of clinicians think that their patients are fine. And I think as a patient, as a female, we tend not to complain about the speculum because, number one, we don't think there's another option. We don't think we have a choice. And usually you love your clinician, you love everything about them. But when it comes down to the tool, the basic tool, when you think about a 200-year-old design, it was time for a change. So we really looked at, so many prototypes, different ways to do this. And we brought in not more of a kind of a medical device, but also a consumer engineer as well to work with us on coming up with a device that would be, number one, easy for a clinician to use and give them better visibility and access, which is crazy important. If they can't see, they can't do their job, but also to make the experience for the patient so much better. And we really wanted to give them a comfortable experience so they would come back. And I mean, we all know I have friends that, they haven't been to their OBGYN since their last kid, 5-10 years ago. And a lot of people avoid it because they don't want to deal with the speculum.
Tell us about that survey. Didn't you do a survey that looked at how many women avoid the exam?
Yes, there's such a huge percentage of women who, number one, avoid the exam just because of the speculum itself. It causes them anxiety, it causes them pain. And then number two, they feel, well, I'm not having any symptoms or problems, so I don't need to go. So we kind of looked at why they're not going when we see that so many of them don't go because of the speculum, because they don't want to deal with that. But you know how important it is for preventative health care. And there's so many things that can be caught early. It just is really important to make sure that we took the device and we made it as comfortable as possible. And we also wanted to give women the choice, the option of a different instrument that can be used on them too.
I love that. And so now these speculums are available at True Women's Health, but I think maybe let's break the suspense. And Missy, if you'd play the video that shows all about the speculum, and then we'll get into more details. How's that?
The first ever kit to revolutionize your OBGYN exam. Here's how it works. First, order your comfort kit. Choose the kit that best fits your body and your needs. There are 5 kits to fit your needs, your body. After that, book your exam. Then, take this kit to your appointment. Once in the exam room, let your clinician know you brought your own speculum to your exam. Hand them the For Your Clinician card from your kit along with the wrapped speculum. It's that easy.
So there we have it. And it truly has been a really great addition to the office. And I think about our patients who come and see us. We have a good relationship. We're talking about everything, but then it's sitting in that gown. And I always sort of make the joke of, here we are with the favorite exam of the year. And there's that nervous laugh. And, again, it's something that I'm a gynecologist. I don't even like going for my exam. It's like, and not only is there potential discomfort, but there's just, especially people who are very private, even if you've had 10 kids, it's private. It's awkward, right? It's uncomfortable. So what kind of feedback have you gotten? And then I can talk about what kind of feedback we've gotten.
Yeah, no, absolutely. I mean, we've all been in that position where you're lying on your back, you have got your feet in the stirrups. My biggest pet peeve was always the stirrups, and if I didn't have socks with me. So that was one thing I wanted to make sure we had some nice fuzzy socks to wear during the exam. And you're, staring at the ceiling. It's a very vulnerable position to be in with your clinician. What we've heard from patients, first of all, over 90% of patients that have used the Nella Speculum prefer it over the existing, metal or other plastic traditional speculum. So they really are very happy about it. We've had patients that said they hardly felt it. I know my own daughter had her first exam about 4 years ago with it, and she's had a few exams since then, and she's had nothing but a great experience. And if anything, that's what I want is the future generation, our children, our grandchildren, to not have to go through what we went through. And so they're more open to having a conversation too, which I find. So we've heard feedback from clinicians too that, it's a dialogue to have with my patient. They were more open to telling me things that maybe they wouldn't be willing to share before. They felt embarrassed to bring up. So it opens up more of a dialogue and allows women to feel more comfortable and more in control of their exam. And the clinicians really do appreciate it as well, because, sometimes it's more of a, they're seeing patients throughout their day, and they want to know what is on that patient's mind. What can they do to help them, with whatever situation they're in. So it's been very well received on both ends. And I think it's led to more communication and more important conversations.
There's so many puns that I could have taken from that, and God knows I chose not to. Both ends open to.
I know.
We don't have to go there. But again, this speculum is again a big part of the exam. And what I always say to my patients: the better I can see, the faster I go. And we really like to, be able to do a thorough exam, but also be respectful of a patient's comfort level. the things that I would notice that patients don't like is with the plastic speculums, it's the waste, right? It's one more plastic thing to add to the waste situation. And number two, with the plastic speculums, there's the clicking, right? You have to kind of lock it in. And so that clicking can be rather abrupt. And in fact, I even warn people, here's a click, it's going to be another click, here's another click, right? So it's not abrupt. And then sometimes, unfortunately, skin can get pinched, of course, as careful as we are. And so, again, I've really, thought that this has been a very thoughtful design. So again, kudos to you for winning the design of the year as well. What I think is really interesting is, so you've designed the speculums, and I'd like you to talk about the different sizes and all that. But I think it's very interesting how the kits apparently were a bit of an afterthought, in the sense of, you thought, right, you'd invent this amazing speculum and doctors would just buy it up like crazy. The problem sometimes with physicians, number one, is they're part of a healthcare system, and the healthcare systems take a long time to make decisions about the cost of something new and stocking something new. And we already have 20 gazillion in the stock room of the old kind of speculum, right? Why would we buy a new kind of speculum? So having said that, it takes a long time to get it into the institutions. And as I understand it, there has been a lot of unpaid media, a lot of buzz, even among celebrities, to have this kind of speculum. And so therefore, as I understand it, your company was contacted by many women who say, my doctor doesn't have the speculum. I see that Brooke Shields and Mindy and, Maria Shriver are talking about the speculum. I want this. So if you would tell me about the birth of the Comfort Kits.
Yeah, absolutely. So first of all, I'm glad you brought up the features, because I didn't really think I talked a little bit more about that before. But so really the speculum is about, the insertion points is narrow like a tampon. So
can you show one while you talk about it?
Absolutely. Yep.
Yeah.
This is on Nella Kind. So it's narrow like a tampon. So if you can tolerate the insertion of a tampon, this will be a much more comfortable experience for you. But from a visibility perspective, it has a light source on the upper bill for the clinician. Very simple to pull the tab. And the biggest thing, my biggest pet peeve was the noise, right? When you open and close it. These are completely silent when you open and close it. You do not hear the noise at all. And from a clinician visibility perspective, it has built-in lateral sidewalls. And this is really what makes our design unique. There's no other speculum on the market like this. With the sidewalls, now the patient's not going to feel that at all, but it allows a gentle kind of four-way separation, if you will, opening to allow the clinician to see the cervix and have really great visibility.
So let me slow this down a little bit. So again, guys, a lot of times we have to open the speculum wider this way to see your cervix, which is sitting up at the top of your vagina. So we've got to see that to get your pap smear or look at it. So we have to open the speculum up really wide. And especially because it's wider at the opening, it feels like there's a lot of width and it's very uncomfortable. A lot of women will feel like they're going to pass gas or they're going to empty their bladder. Like there's a lot of pressure front and back. So what's cool about the speculum is it doesn't open as wide. It doesn't have to open as wide because there's little sidewall things that come out. And I'd love you to show that again, Tracy, just from the other angle. Show it from the other angle. You can't really see it that way. I can't really see it that way either. Sorry, you're right. So there's do it that way. There you go. Perfect. So there you go.
For the sidewalls, but the patient's not going to feel that because you're always going to have vaginal sidewall pressure.
It's just really bouncy. It's not driven. There's no spring. It just sort of gently comes open. And having said that, we talked about plastic. So there are disposable or single use. Do you have one of the reusable right there?
We do, yeah. We have a reusable as well.
So what's really cool is it's not metal. It's not cold.
No.
We have them in the drawers, but they don't need special warmers because they keep an ambient room temperature a lot better. Yeah. And show the sidewalls if you would on this one.
On this one, same thing. It has a lateral sidewall.
Yep, show it the other way. Sweet.
Yep,
and show how small it is, like how small the opening that you feel at the vagina.
Yep. It's exactly the size of a regular size tampon. So again, very small. This is all you're going to feel. This will allow the clinician to have access and visibility. And it's quiet. And talk about, the metal ones. Like I have a metal one here just to show you a comparison. So if you look at the difference in the bill size, it's a huge difference, right? Metal's cold to touch. It's clangy. It makes that noise. This is temperature neutral, so you don't need to warm it or do anything with it. The patient's not going to feel that temperature change. And it's just, again, that quietness when you open and close it, you do not hear the noise.
Yep. And what I love too is that the metal speculums are hard to clean. The screw thingamajiggy, it's just gross. So at True, we decided not to have metal ones because they're just too difficult to clean. And they're too difficult to scrub, and it's a whole thing. So we've just ordered, I don't know if you saw the order come through, but we just ordered some non-disposable. So, so when patients come to True, you certainly can ask for it. As they come in, we'll have them in each one of the rooms, and then we'll also have some of the disposable for when that's needed. And then, of course, we also have the kits. Now, if we have it at True, a person might not want or need to buy or bring the kit in, but it's kind of cool, or maybe to give as a gift or to give to someone who goes to a doctor who doesn't have the Ceek speculum.
Yeah, absolutely. And to get back to your question about why we did create this comfort kit, it really goes back to healthcare systems and how slow they are to make change. So I wish I could say it would take 6 months, but it doesn't. It can take a year or 2 years to get a product incorporated into a healthcare system. It just takes a very long time. And I understand they have lots of things they need to focus on. And sometimes women's health or speculums are not at the top of their list. So we launched in 2020 our reusable speculum, and probably 2 years after that, in 2023, we launched the single use. We have a fantastic marketing team, and patients started to hear about this Nella Speculum. So about a year ago, we started getting a lot of calls to our customer service, a lot of emails of patients saying, listen, I don't want to wait for my clinician. I love my clinician. I don't want to wait for the system that they belong to make this change. Can I just bring this to my exam? So historically, we just started, like most medical device companies, marketing to clinicians and healthcare systems. That was always our intention. So last year, we registered the kits with the FDA, and we also worked with the IRS to get HSA, FSA approval for the comfort kits. So what that means is that patient can now buy the kits from you at your place or online from us, take them to their exam, and again, use their HSA, FSA funding. And it just gives them that option of choice, right? You can still absolutely go and use what your clinician's using if you choose to, but this gives you another option. Great for first-time exams, as you know, for menopause patients, for patients that have a history of, say, gynecological cancer, really anybody that has a history of trauma or sexual assault, any patient that has any anxiety at all. This is a really great option for them to give them an option of choice.
Exactly. And I can see in the chat, there's the link to the speculum. People can buy it, can go right to the True Women's Health page and order their kit. But I think this also just opens up a conversation about the exam exactly, right? This GYN exam is so important. Number one, I hear a lot of times that people say, well, my primary care doc says I don't need a pelvic exam anymore. Friends and neighbors, that is not true. We don't have to do a pap smear every year, only every 3 to 5 years based on your most recent HPV and pap smear results. But you don't need a pap smear every year, but definitely still a pelvic exam. I can't tell you how many times we find conditions such as, let's say, lichen sclerosis, or maybe a bacterial vaginosis, or it gives us an opportunity to talk about pelvic pain. Just the other day, found a lady with a pelvic mass she never would have known. And hopefully it turns out to be nothing, but we found it. And so, moving forward, it's just to make sure that you get that pelvic exam every year. And again, I'm fascinated on the survey you did that a lot of women say, because of the speculum, because of that instrument and how that's used, I'm not going to go.
Yeah, we were so surprised by the results and really trying to understand, number one, did women really know what a speculum was? And over 90% know exactly what a speculum was. And more importantly, they knew what was used on them. And then the percentage of women that said one of the reasons they don't go to their annual exam was because of the pain and discomfort the speculum caused them. And this was, we're talking about before the anxiety leading up to the exam, right?
Right.
Had people that purchased the comfort kit and just saying the comfort kit in their hands already reduced their anxiety level, knowing that they had some power and control before they went in. But as you know, there's pain during the exam with traditional speculum, and also some bleeding, some soreness, and afterwards. So we just wanted to give patients the option of having choice to have a more comfortable experience. And more importantly, to educate them on the importance also of the annual exam. I know there's some confusion about when you need to go and how often you need to go, but we like to tell them really it's important to see your clinician every year.
At least every year. True, yeah. 2 or 3 or 4 times, right?
And
I've got a kit here. You probably have one as well, but just to show if someone chooses to get the kit, it comes with a speculum. I'm not going to open this one because I don't want to waste it. So this is in the package.
Right there,
Yep. So this is a comfort plus or comfort. Thank you, Nella. And then it comes with comfy socks. We'd love to have more socks at True, but I don't think anybody wants to wear socks that somebody else was wearing, and the little foam silly things that sit. So wear your own socks or get some Nella socks. There's some lube that we of course have at the office, but it's sure nice to have this pH balanced neutral lube. There's a wipe afterwards. Again, at True, we have wipes as well for people, but people can feel empowered with their own. And then in your kit, you have lavender oil. We don't have that at True. So
essential oil.
Thank you so much. That's right.
Yes. And the little
what was your?
So we really wanted to look at the whole exam experience and say, what can we do from start to finish to make the stress ball? I used to count ceiling tiles during my exams, and now I like to just hold the stress ball and just distract you from the exam itself. But the way I think about it from start to finish, the lavender essential oil is just really great to put on, put a little on your wrist, and just kind of gives you that calming sensation before you go into your exam. The socks, again, that was my big pet peeve. I hated putting my feet in whatever was there or nothing. So having a pair of cozy socks to put on and just, not to worry about that. During the exam, again, the stress ball you can squeeze just to distract yourself from the exam. And then what I found very interesting is after the exam, I would always use the paper gown or the cloth gown to clean myself up after the exam and, get dressed and go about my day. But I was talking to a lot of my friends and they said, oh my gosh, I have the lubrication. I just put my clothes back on and go back to work. And I have that in there all day. And I'm like, that's got to be so uncomfortable. So that's why we wanted to include nice pH balance. We call it a post-exam wipe. So you can clean yourself up, feel fresh, put your clothes back on and go about your day, whether you're going home, shopping, back to work, wherever you're going. It just makes you feel more comfortable going back to your everyday life. Yeah.
Sure. And I think, again, this just brings up the whole element of choice and feeling safe and feeling in charge, right? I think, a lot of times too, people are very surprised when we pull out the mirror. So a lot of times as part of the exam, after, of course, we've asked for permission and clarity and let people know that if they want us to stop at any time during the exam, you just have to say stop and I'm done. I won't say just a minute, honey, right? Like stop. But also that we might pull out the mirror and say, do you want to watch while I do the exam? So you're involved. You don't feel separated from your body, right? While we're doing the exam. But it's that whole element of choice and feeling really involved and giving consent.
Yeah, I agree. I agree completely.
Tell me about your thoughts about trauma-informed care. We talk about this a bit. And unfortunately, too many women have suffered sexual assault or they suffered exams that were very painful and they didn't feel the empowerment to say, you need to stop, right?
Yeah.
Have you done some digging into that at all? I would imagine you talk about that.
Absolutely. That is one thing that we've really learned with these comfort kits. It's opening up that dialogue. And a lot of times, we're all always in such a rush to get through our day. And I know there's so many more patients that need to be seen. And just to have that conversation and have your patient feel comfortable bringing up if something did happen to them, if they had an experience, if they were sexually assaulted, or if they've had a prior past experience with an uncomfortable speculum exam, it really does allow that conversation so you can have a different point of view. And I had this one patient talk to me about her very first exam. Her clinician did not know it was her first exam and just inserted the speculum. And she was also a virgin. She was not sexually active yet. And she really felt like she just lost her virginity to a speculum. And so just to not have that conversation, she carried that with her for quite a while. And so she felt now having the comfort kit, she could go in and she could tell her story. And and talk about, her experience. But there's so many people, whether again, it's your first time, you're in menopause, anything in between, that have some type of experience. I've really never met somebody that says, oh my gosh, I love going to my pelvic exam. I can't wait to go. So I just think this just adds that, you have that level of empowerment, dignity, and it just gives you that that feeling that you're more in control of the situation. The one thing I always like to point out to especially my friends, who don't go, I said, you would never, if you have children, I asked them, would you ever miss your child's well child exam? Their 1-year-old, 2-year-old well child exam. And they said, oh my gosh, I would never miss that exam.
Right.
That is, so you should never miss your exam. That's how important it is. Because if you're not taking care of yourself, we're often caregivers of children, family, spouses, parents. We take care of so many people. So it's really that education on the importance of the annual exam, taking care of yourself so you can take care of all those people that you love and love you, but also having that choice when you go into your exam.
Exactly. And keeping it real with my dog back here. Sorry. No other humans are around, but it's just so key to make sure that that exam happens. And again, so many times we find, issues, conditions, or again, just bring up topics. Even we talk about, the risk of course, cervical cancer and safe sex and STI. And again, when we have a first patient visit, we show the speculum, we show the pap smear, like people can feel the brush and feel. So again, this just adds, so hopefully on a bigger scale, this happens even more. So I just so congratulate you and your company on making this kit for us. I see that there's not a lot of comments, and so I totally understand. I get that you might not want to participate in the discussion, and I hope this is being helpful. If you have questions after the fact or want to ask in privacy, you can DM us at True, and we'll make sure and we get back to that. We always talk about some key takeaways. And so key takeaway number 1 is that medical tools impact the patient experience. So if you would talk about this a bit, Tracy, like as you've learned about design in general, you must have been an engineer in a former life, right? So tell me about how you think about design.
Yeah, no, that's a great question. I think I probably secretly should have been an engineer, or not secretly, should have been an engineer. But one thing that's so important is there's so many things when you make a minor change and how it impacts another part of the product. And the number of prototypes we went through, and we really wanted to really have a comprehensive design team of people that, both men and women. I've sat at tables before with a lot of men engineers, and I really wanted to make sure that we brought women to the table who've experienced the exam but had that design background. But just the thoughtful details that we put into every part of the speculum, whether it's the packaging, how you take it out of the bag by the handle, to how you use the product on the patient, how the patient receives the product, all the way to, if you're using our reusable device, how the person who's cleaning the devices. We really thought from everything from A to Z and who touches that speculum and how to make their life easier, because it really hasn't been thought of in almost 200 years. And we just we were using the same design and not really thinking through how that could be improved. But lots of prototypes. I mean, thousands of prototypes, lots of clinical testing. We wanted to make sure that we had it, I would love to say we're perfect, but we're definitely not. I think it's almost impossible to have the perfect product, because the minute you launch it, you're going to find 1,000 things you want to change already. But we really did find what I think with the Nella product, the Nella Speculum, a product that will make most patients have a more comfortable experience and want to go back every year for their exam. And that really was our goal.
Right. And again, even, with how I'd like to think we make this as comfortable as possible. Missy, if you go to point number 2, takeaway number 2, this really has prioritized comfort and dignity. And how I say that, again, a lot of people tell us at True, it's a very comfortable experience. It's a spa-like environment. I know you came to our office, and
Yes.
So very honored to have had you at the office. But even then, patients will be a bit shy about, can I have a small speculum? I have a really high tone pelvic floor. My muscles are really tight. Intercourse hurts. I'm really worried about this. They're even shy to ask us in an environment where we work really hard to make it comfortable.
Yeah.
And so again, just having this, here's my speculum. I need you to use this. especially if it's an environment not like True. And again, a lot of gynecologists, they've been doing this forever. They think I'm the best. I do a really good job. And by just a person bringing the kit to their appointment, I think is really powerful.
Yeah,
So,
and I think that's the big common misconception is that because patients don't normally complain because they don't think they have a choice or they don't think it's going to matter. And a lot of clinicians think, oh, my speculum exams are perfect. And I'm not saying they're not. What I'm saying is that sometimes having a better tool will help make that not just the examination better for your patient, but open up that dialogue. And I have to tell you, your clinic is one of the, I mean, it's beautiful. It is so nice. I wish I lived closer to Grand Rapids, Michigan. And we're just thankful that you were the first site in Michigan, in the state of Michigan, to not only accept the Nella Comfort Kit, but have them available at your office and also have the reusable available. So we really appreciate your support with that.
Well, we really believe in investing in this exam, and especially when we have someone who's had prior difficult exams, or when women come in for their very first exam. I always say, like, now hopefully going forward, you're not afraid of this anymore. Hopefully this is something that we've created, like a good new start to the rest of your life. And again, it could be minimized, like, oh, that's no big deal. Like, who likes to go to the dentist? Who likes to go to the doctor? But no, it's a really, really big deal. And we don't want people to put off their care. So takeaway tip number 3, there are options. Talk about different body types and different life stages. I know you've created a couple different sizes and models.
Yeah, no, absolutely. So the Nella Kind, which is the purple handle one, or this reusable version, we call this the Nella Kind because it's a kinder option. It really is designed for most patients, and it's great, especially for your first time exam. If you're a menopause patient like me, it's the essential speculum for that.
Not as big, it's smaller.
No, this is the one that's narrow like a tampon, absolutely. So it really is great for most patients. However, though, if you are a little curvier, say you've had 3 or more vaginal deliveries, you might have some what we call vaginal laxity.
The sidewalls going to fall in.
Just pull in. And you could be the tiniest person, but those vaginal deliveries, as you know, stretch you out. So that's what we have the curvy version or the maternity version for, which is the Nella Next version. So this version is similar as far as it's quiet, it's narrower, it's a little bit wider than the pink version, as you can see. But what we do is we add what's called the view sleeve to it, and that competes everything back. So normally, Diana, if you were to say use a medium, speculum and you couldn't see, you would then normally go up to a larger size, right?
Well, again, because if you open it wider from front to back, you hope that the sidewalls fall. But as you and I also talked about, sometimes when someone's had a lot of babies and there is laxity or some pelvic prolapse, what happens is we'll do the glove trick. So I've done the glove trick many times where I take a speculum, I put it in a glove, I cut off the hand of the glove and just leave the finger on the glove. So when I open it, the sidewalls, but then it's just really narrow and it's really tight and, it's awkward. So again, this is just genius.
Yeah. So this is the view sleeve, and this view sleeve works on any, what we call bivalve speculum. So any speculum that has the 2 valves. And what it does, especially if you're what we call a curvier patient, or if you've had, say 3 or more vaginal deliveries, it really just goes right on the speculum and just keeps everything completely back. So nothing's going to get in there. That lax tissue stays back. But this footprint is so much smaller. I'll give you an example. I'll say this is a large plastic speculum. So this is a large plastic, which we never want to use, but sometimes we have to. You can see the difference in size. This is going to give you a much more comfortable experience. So again, curvy, more than 2 or 3 vaginal deliveries, or if you're pregnant, this is also the one that's in our maternity kit as well. So when you have all that pressure and you're going in to deliver, and you want to make sure they're doing a cervical check, it just lets you have a more comfortable experience without putting all that pressure.
Right. Well, the other thing that we talked about, doing any procedures that have electrocautery, it's a way to protect the sidewalls, right? That sleeve is made of silicone.
Yes, that's a great point. So it's medical grade silicone, so you can use the sleeve. I'm going to take it off of the speculum. If you, whatever electrocautery or whatever leaf speculum that you have, you add the view sleeve directly to the speculum, and it acts as a complete insulation. So If you are doing a LEAP procedure, any electrocautery procedure, and your patient moves and you accidentally touch the sidewall, which is always the biggest fear, your patient does not feel anything because it's medical grade silicone. I could stand here all day and nothing will happen. You will not feel anything. So that is, to me, that's a no-brainer for any electrocautery procedure to use the View Sleep, because it acts as just a reassurance that nothing's, I'm going to protect my patient in case something happens during, whether I'm teaching, whether I'm learning,
coughs or I cough.
Years. Exactly. So View Sleep is a no-brainer for LEAPs.
So women demand this, demand the sleeve, because if you don't ask for this, it's not going to happen. Because again, if we don't hear about it, if doctors, especially in the large healthcare systems, don't hear about it, it's just easier to not, right? It's less expensive. They don't have to go through all the meetings, all the bureaucracy. It's easier just to not go there. So if you don't ask for it, it's not going to happen.
Yeah, completely.
All right, takeaway tip number 4. Yes, we do. Providers play a crucial role in improving the experience. So again, that's why at True, we want to support the Ceek Speculum. Again, thank you, Rachel Bronsure, for bringing us together, because again, we have to bring it and talk about it. And then again, patients need to demand it. So we need to support each other in these novel tools and move medicine forward, so we're not stuck in the dark ages. What, 1800? Was that the dark age you talked about?
Yes, 200 years ago. I mean, it's hard to believe that we're using a device that was invented in the 1800s.
Exactly. Yeah. So my eyes have been opened. And number 5, yes, True is leading the way in patient-centered modern women's care. So again, we are very proud to be the first in Michigan. And again, Tracy, to have had you come to True and introduce our entire team to the Speculums also, thank you for coming all the way from New York. And hopefully you enjoyed our beautiful city for a hot second.
I did. I love Grand Rapids, Michigan. And anybody that lives near there, yes, True is a great place to go for your GYN care. Absolutely.
But we think too, by us having it, we hope that all boats rise, right? We hope that then all other clinics are like, well, if True has it, we better get it, right? We don't want them to be the only one. So that little competitive spirit is a good thing. Yeah. And so if other people get it, awesome, because that means that we're helping elevate everyone's experience in West Michigan, in Michigan, in the greater area. So we're prepared to shout this from the rooftops. So at the end of these conversations, we always then get into questions. So if you happen to not be in the area and you need your exam, we want you to be able to seek out a provider. And there's always questions we want you to be able to ask. Mm-hmm. So question number 1, as you go into this appointment, is the classic, what we always say, I want you to ask your provider, what is my phase of ovarian function? Am I in reproductive phase? So in terms of the pelvic exam, your estrogen levels are going to be higher. The tissue is more stretchy. Your collagen is good. It stretches and gives. And hopefully the exam won't be too uncomfortable. But again, still to think about that perimenopause, it just depends on your body type, your estrogen levels, if you're in early perimenopause or late. But it's really important for you to know your phase. And then, of course, menopause means you haven't had a spontaneous period for over a year, or you've had your ovaries removed, or you've had, let's say, chemotherapy that put you into early menopause. So if, especially you're in menopause with low estrogen, the Ceek Speculum is something that will really change your experience. Tracy, sorry, anything you want to add to why this is important?
I completely agree. Again, from that first time exam to menopause, it's a game changer. The Nella Spec really makes your experience so much more comfortable.
Cool. And at True, we see patients who are 15 to 105, I think, is our oldest patient. And so again, pelvic exams need to be done that entire spectrum. And so if someone's 105 and they're like, I haven't had an exam in how long? Well, it's really important. If nothing else, we don't want you to have bacterial vaginosis. We don't want you to get a bladder infection and kidney infections, and that can make people really sick. So again, we've got to be able to do that speculum exam without causing discomfort. So question number 2, please ask your provider, is there a more comfortable speculum option? Again, I remember one time being at the gynecologist, and they still had paper. And at True, of course, we only have cloth. There is no paper anywhere. And I was shy. Like, I didn't want to be a pain. I didn't want to be high maintenance. The stupid paper ripped and I said, forget it. I'm always bringing cloth with me. And so you're not bothering people. It might take 2 more seconds. And even if they don't have a more comfortable speculum at the time, you've asked the question, you plant the seed, you let them know that this is something you're thinking about. And it's like you're taking back your power. So it's okay to say, any options for me?
Yep, I completely agree with that.
Cool. Question number 3. Do you offer tools or approaches designed for women different stages? So this, again, is so important to think about because you might go in for your exam. It might be just your once a year GYN exam. Again, at True, we want to see you at least 3 times a year so we can stay in touch and be aware of what's going on. But if you go at least just once a year, you want to know what else they offer versus a 10-minute pap smear appointment and you're in and out of the office. Then there's no entry for later. So it's super important to say, as life happens, what can I expect from your office? How are you going to help take care of me? Question number 4. So what steps do you take? You can even ask your provider, have you had any training in trauma-informed care? You could say, I really appreciate how you asked me about my prior experiences, or, how come you didn't ask me about prior experiences, right? Like, again, I want you all listening to be empowered to ask these questions. What is your experience in this? How is this exam going to be okay? If I say stop, are you going to stop? Can we look together at my bottom and can we make sure everything is healthy? So again, it's okay to ask for those things, those questions. And question number 5, if exams are uncomfortable or painful for me, or if after this exam I want something different, what are my options? For example, can I request a Nella Comfort Kit, or this might drive you to say, I'm going to bring my own kit next time. Don't be surprised.
Yeah, absolutely.
So, super important. And, I just really am so thankful, Tracy, that you've come on the show, that you've allowed us to have this conversation. I know we'll be resharing this episode. My sense is you will as well. We'll make sure that Rachel Bronsher knows that we were here, and I bet she'll be sharing it as well. For all of you out there watching this, I hope that you follow up with any questions you might have. Make sure you check out their website. You can get to their website also through ours at truewomenshealth.com, check out nellaspec.com. Tracy, any last words, anything that we didn't get to that you might want to make sure people know?
No, I think we've had a great conversation. I've really enjoyed it. It was so fantastic meeting you before and seeing your clinic. It was so amazing. We appreciate all you're doing, not just with the Nella Spec, but just in general, your practice, the way you run it, your clinicians. You really, it's very impressive. So thank you for all you're doing to help women and help women's health. We appreciate that. And just, anybody, if they have any questions, you can reach out to us on our website, our color customer service. But we really just want to make sure that everyone is informed and has an option to have a more comfortable, dignified exam.
Wonderful. And everyone out there, please know you can request a kit at the office, the entire kit with the stress ball and the speculum, and you can use your HSA to pay for it. It's a very reasonable fee. And so when you come, you can request your own kit, or you can request that we use one of our own speculums that should be arriving any day. We have one right now, and actually us clinicians, we're kind of fighting over who gets it. Yesterday I had a patient, I'm like, I need it, so make sure it's sterilized and ready to go. So it's kind of funny. So we'll be having more at the office, and we won't have to fight over them anymore. So again, Tracy, thank you so much. Everyone out there, have a great day, be safe, and be informed.
Thank you, Diana.